For more on the Capitol Hill healthcare showdown, we're joined from our Washington bureau by Rachel Bade, congressional reporter for Politico. Rachel, good morning.
Good morning.
So we now know Senator McCain says that he will not vote for this, and it looks like Republicans are once again one vote shy of falling short of that 50 that they need. Is there a chance that this legislation doesn't even go for a vote, hit the floor?
There's absolutely a chance of that. Senate Majority Leader Mitch McConnell was very careful when he said last week that they were going to vote on this week. He said he intended to put the bill to the floor. However, if he doesn't have the votes, it's unlikely that he's going to make his conference take that tough vote again and put them on the spot. I would just say that McCain basically killed the cat that had 9 lives, right? I mean, how many times have we heard talk about Obamacare repeal bill? The Obamacare repeal being dead. We heard this in the House in the spring, all throughout the summer in the Senate, and once again, McCain is coming out and saying he won't vote for this. Susan Collins is probably not going to vote for this. She's a moderate. She's never been big about repealing. Also, Rand Paul saying it doesn't go far enough in terms of repealing Obamacare. So what you have here is about 3 senators who are going to block this. Now, the difference this time is that lawmakers really only have 1 week to do this because their ability to do this on a party line basis expires at the end of September. And so while everybody said repeal was done, and then they continued working on it, now they're actually running up against the clock.
Rachel, how does this legislation actually differ from the last?
Well, that's what a lot of people are saying. They have deja vu right now. And yes, this bill is different. It doesn't repeal as much of Obamacare, but it block grants money to the states and allows them to do whatever they want with that money. But the thing is, a lot of the concerns are very much the same, and that is why people are saying they're sort of getting deja vu, right? So you have conservatives who want to go a little further to the right, and you have centrist and moderate Republicans who are concerned that people in their states are going to be kicked off Medicare, low-income folks who can't afford health care, and they're worried about that backlash. You have a lot of Republicans, traditional Republicans, and also moderates who are concerned about people with pre-existing conditions and basically are, worried that this bill is going to allow insurance companies to charge sicker people more than healthier people. And so I think that a lot of the debate is the same, and that's why this bill didn't really go anywhere.
And that last concern is one of the things that we've heard from talk show host Jimmy Kimmel. He's been out very much against this bill right now. Seeing someone like that weigh in, does that have an impact in Washington?
Usually I would say celebrities do not, but this instance it does because pre-existing conditions are really important to people in terms of protecting.
Rachel Bade, thank you very much for being with us this morning.
Thank you, absolutely.